Hey everyone, happy Friday. Thanks for joining us, and thank you to our Belfouche Chamber for putting on these virtual seminars that you're doing every Friday, and to all the previous presenters that have been on the previous Fridays. I'm Dr. Julie Wingen.
And I'm Dr. Melanie Rye.
And we are part of your team at Pain and Movement Solutions in Belfouche, South Dakota. So, as doctors of physical therapy, we are neuromuscular skeletal experts, meaning if you have a pain or movement problem, and you're not interested in surgery or drugs, we are your first choice healthcare providers. And contrary to what a lot of people think, you do not need a referral to come and see us. All you got to do is give us a quick call. We'll get you in and get you taken care of, get you feeling better. And we also have telehealth options available now. And now your insurance companies are covering our services at 100%, meaning if before you had a deductible or a copay when you were receiving physical therapy, all of that is being waived as a way to try to get people to be healthier and stay home and safe during these difficult times. So it's a really good opportunity that people are taking advantage of, and we encourage you to as well, so that you can come out of this pandemic stronger and healthier. So today we are here to share our expertise on what you can be doing to stay healthy. We are obviously going through challenging times. You might be feeling that, like with that knot back in your shoulder blade because you've been sitting at your laptop at your dining room table. Or maybe you're getting headaches because you're trying to remember how to divide fractions as you're homeschooling your kids. Or maybe you're feeling some more fear and anxiety because with all the unknown around the virus, and you're really worried about how you're going to keep your family safe. So when this happens, we have a lot of increased glucocorticoids released in our system, which is like cortisol, our stress hormones, and that's all getting dumped into our body. And when that happens, our immune response is dampened and our body has an increased difficulty with trying to fight off viral infections. So, and it's hard to not be stressed right now. Anytime you turn on the news, all you see is information on isolation and ventilators, as if these are the only things that we can be doing right now to be keeping ourselves healthy. So isolation has done its job that it's supposed to. We've flattened our curve, and most importantly, we're keeping our high-risk individuals safe. But unfortunately, isolation can cause a lot of detrimental effects on our health. And one of them is our decreased physical activity levels. I know personally when I'm working remotely doing telehealth sessions, I don't move near as much as I would if I was in my typical normal routine. So, and when we have decreased physical activity levels, there's tons of research out there that shows that we have an increased risk of developing or worsening of chronic health conditions, and then our body's ability to be able to fight off viruses worsens as well. Did you know that the United States is actually ranked 35th with regards to our health? It's a pretty poor statistic that we aren't overly proud of, especially considering all our wealth and resources and being known as one of the strongest nations in the world. However, we start to become a little more vulnerable when we're dealing with the global health pandemic. And you can see this in our media. Anytime you get on entertainment site, they're always talking about what you're binging on Netflix. You know, increased sedentary behaviors right now is not going to help us fight this virus. We need to be changing that message that we're seeing in our community and across our country on really, like, what are you doing to stay healthy? What are you doing to be more active? How are you going to come out of this pandemic stronger? So we all know that we need to increase our physical activity levels. That's not breaking news. But Dr. Melanie is here today to kind of dig into all the research and help us understand why it's more important now than it has ever been.
So as Dr. Julie just explained, and kind of went through some of the impacts that this social distancing and staying at home time in our lives and what impact that is having on us, but it also has an impact on our immune system. So why do we care? We care because we definitely want to protect ourselves, but also, you know, our families and our loved ones. So when we look at kind of our stats from South Dakota on coronavirus, it kind of disproportionately affects people by age. So people, you know, 40 years old and above are really at a higher risk for death and mortality because of the coronavirus. So, and as that age goes up, we see worldwide that statistics rises. So we know that even before social distancing, that when we could go to the gym, when we could go, to our Zumba class or our cycling class, we had our partner to get us out of our house and go to the gym, that even then we were, not doing that well on our exercising and our physical activity. So research shows that less than 5% of adults participate in 30 minutes of physical activity a day. And that's 1 in 3 adults are getting the recommended dose of activity per week. So, and that translates into older adults as well. So 30 to 45% of people 65 and older are only considered physically active. So that leaves a big portion of people not participating as well and putting them at a higher risk. So we know that there's a huge need for exercise and physical activity, which is, the one thing that we specialize in here. We know exercise and we know movement inside and out. So, and we also know that up to date of kind of research into the coronavirus, that exercise has the most evidence to demonstrate protection against, all respiratory viruses, not just the coronavirus. So, and even when you compare it to, some of these drugs they're coming out with to possibly, treat coronavirus, exercise definitely beats those statistics as well. So as I go forward here, we're going to kind of start unpacking some of, how exercise is protective and what you can start to do as well. So now, as you can see kind of behind me here, there is the list of benefits of exercise. So we consider exercise medicine. So some of the benefits that I've listed are increased bone and muscle mass, which has, an effect on your body and how you can survive certain infections. There's improved digestion, reduced stress. You can have some gradual weight loss. It'll, improve or enhance your immune system. You can have protection from chronic diseases, improve your brain function, your sleep patterns, and even fight against anxiety and fear in this time. So the list could go on and on. These are just kind of some of the more basic and highlighted factors that we look at. So as we go into more of protection from the coronavirus, but also other respiratory, infections and viruses that are out there, we know that when you exercise, there's cellular and molecular events and reactions taking place in your body, and this happens seconds to minutes of starting that exercise. So when you're exercising and these things are taking place, that starts to slowly reduce the number of free radicals in your body, and also reduces your oxidative damage to, muscles, heart, liver, things like that. So to break this down just a little more, oxidative stress is that damage that happens in your body, and this is caused by a buildup or overload of free radicals. So, and this overload and buildup is what is considered some of the starting points for some of those health conditions or chronic diseases that we've been talking about. So this overload plays a major role in the development of certain aging factors, chronic and degenerative diseases, arthritis, immune disorders, inflammation, and even cancer. So essentially, when we exercise and this antioxidant effect takes place, it places a protective mechanism for your body and even your immune system. So even just one single bout of exercise is going to show those benefits and be helpful to your system. So even if you haven't been exercising before all of this started, before the pandemic started, you can still start now, and they'll still have those same protective benefits for you. So next, another thing that happens when you exercise is you increase your lung capacity. So you're gonna improve your cardiorespiratory fitness, and this is gonna have a direct positive impact on the physiological functions of your main organ system. So you have your respiratory, your circulatory, muscular, nervous, skeletal system. Those are the main ones that are going to be impacted first. And then indirectly, you're going to have, secondary benefit of some of the other systems like your digestion, your immune function, your renal system, and even your endocrine system. So and all of these systems can be impacted by the virus if you do come in contact with that. So it is a very important protective mechanism. We do know that moderate intensity exercise has been shown to demonstrate, a positive immune response, and specifically in your lungs. And this is associated with improved survival rates. So, and this is with any respiratory infection, not just the coronavirus. So, and also research has shown that 20 to 30% there's a 20 to 30% reduction in upper respiratory viruses and infection shown in individuals who, have that moderate activity in their daily life. So just having, that routine to have that moderate physical activity each day is going to put, 20 to 30% reduction in your risk, which is a pretty good statistic that you can control. So looking at all these risk factors that you've been talking about or hearing about in the media that put you at risk for getting the coronavirus or becoming infected, we know that having a low cardiovascular or cardiorespiratory fitness is the highest predictor and strongest predictor of mortality. So, and this is compared to any of those other risk factors that you've heard. So pretty important factor of how your lung capacity is doing. And as we know, the coronavirus, we're still looking into lots of research. We're still learning a lot about how exactly the coronavirus works, but we do know that the virus presents a number of respiratory symptoms. So those respiratory symptoms are also associated with, how you can improve your cardiorespiratory fitness and that immune response to any other respiratory infections that we do know more about. For example, exercising at a moderate to vigorous intensity level improves your immune response to any respiratory virus, but also reduces chronic and that low-grade inflammation in your body, systemically as well. So here again, even just that one bout of exercise is going to help improve your susceptibility to getting the virus. So let's say you have, person A over here who has been exercising for, that day. They did their 20 to 30 to 60 minutes of exercise that day. And then we have person B over here who was more sedentary. They didn't quite get their exercise in at all. They're, had a down day. When those two people meet, in the same place and they come in contact with that virus that day, this person A over here, they have a less, likely chance of getting that virus from wherever they came in contact. Let's say the grocery store. They have a less likely chance of having that infection, get into their system. But also if it did, they would have a less likely chance of, it's not going to have as severe effects for them versus, person B who was more sedentary that day. They have a higher risk of getting that infection, and then they could have more detrimental effects from that virus as well. So even that single bout of exercise is going to protect you right away. And so why does this happen? We know that when we exercise, that literally billions of lymphocytes, so lymphocytes are your white blood cells. So lymphocytes are going to be mobilized and throughout your whole body. So that's going to create what's called a immunosurveillance or surveillance throughout your body. And it's kind of a watchdog on what's going on in your body. And it's going to help fight off some of those things that could come in contact with you. And this is especially true for exercise that kind of taxes your system. So getting your heart rate up, getting some, heavier breathing, that's going to especially protect you as well. So overall, exercise training has been shown to improve your immune response to not only, coronavirus, but also the influenza, rhinovirus, pneumonia. Those are all particularly, high, seeing things over in this part of the state as well. And this is shown to, all ages, so young to old and even older adults. We know older adults are more affected by coronavirus, and so it's safe to assume that all of these protective benefits can be, throughout your lifetime. So now that we've kind of unpacked all of that, physiological function and how your exercise can protect your body, we're gonna kind of go through what you can do and what you can start doing here. So I have listed here some of the recommendations on what you should be doing or what you can be doing, whether or not COVID is around. So and this is for all ages. So preschool age, years 3 to 5 years old, should be getting 3+ hours a day of physical activity, play, and whatnot. Children through adolescence, so 6 to 17, they should be getting 60+ minutes a day. And then, for adults and older adults, we should be getting that 150 minutes of aerobic exercise per week, and then also 2 times a week of muscular strengthening. So we've come up with 3 strategies for you to be able to kind of get yourself back into some of these recommendations and maintain your health and fitness during this time of social distancing where you may be more at home. So first, you want to keep moving. So moving at an intensity that, intensity does matter at this time. It's not, it is an important factor of how you're moving. So intensity means, getting that heart rate up and getting some, heavier breathing like we were talking about earlier, where you are getting, words out at a time, 3 to 5 words or a sentence, but you're not carrying on a casual conversation. So you are taxing your system a little bit, and doing this for 30 to 60 minutes a day. Secondly, you want to maintain your strength. So maintaining your strength at home is, you can be done by just body weight exercises, and you don't really need a whole lot of extra equipment at all. So, and then lastly, you want to stretch regularly. So stretching is going to help maintain your flexibility, and flexibility is going to help prevent some of those potential injuries. It's going to help those muscles feel less tight from being, at home and maybe sitting more often, and helping that joint stiffness as well. So I've come up with 3 different types of exercises or exercise programs that are going to be easy to do at home. They don't need a whole lot of equipment, if any, and you can kind of pace them on your own as well. So it doesn't matter where you start, if you haven't exercised at all, or if you're just trying to, get a new routine while we're at home and social distancing. So the first one is a 10-minute AMRAP. So Julie's going to demonstrate some exercises for us as well. So an AMRAP means as many rounds as possible in what I have is 10 minutes. So you could scale this to 8 or 7 minutes, whatever you feel like you can do. So you'll set a timer for 10 minutes and then go through these 2 exercises, as many rounds as you can within that 10 minutes. And then you rest as you feel like you need to. All right. So the first one is you'll do 12 glute bridges. So Julie's going to show you what a glute bridge is. So even though you're trying to get through as many rounds as possible, you're still trying to do those exercises correctly with good quality, and not just going through the motions. And then the next one, you'll go straight into dumbbell thrusters. So this is a really good functional exercise, getting full body movement through a big range of motion. So if you don't happen to have dumbbells like Julie's using, you can grab jars off the shelf, cans of soup. Some people have thrown books into a duffel bag and kind of press that above their head as well. All right, so then you'll go through that as many times as you can, kind of document that and see, how you improve throughout the days and weeks as you go through. So the next one I have is a little longer and a little bit more intense, but still doable for anyone. So this is a 20-minute EMOM. So EMOM means every minute on the minute. So you're going to set any kind of interval timer that you may have. You can get an app. You can, type it into Google and get a YouTube app here. But what is going to happen I have 4 exercises in 5 rounds. And what you're going to do is when that minute goes off, you're going to start your exercise, and however long that takes you, if it takes you 30 seconds, then you have a 30-second rest. So the first one is going to be 10 step-ups. So, find a curb or a step in your house and go up and down the step 10 times. And so you can also add weight to this as well if you need a little extra intensity there. So if that takes you 30 seconds, you have 30 seconds until the next top of the minute. And the next one is burpees. So get yourself down to the floor and then pop yourself back up and maybe do a jump at the top. So these are a good full body exercise as well. And the next one is going to be squats, so 15 squats. So if this one takes you 45 seconds, then you have only 15 seconds to rest. So it kind of depends on how it goes for each exercise. You may have more or less time to rest. And then the last one is a 30-second plank. So you can hold it or you can do the plank up downs as well. And then you'll have 30 seconds. So keep going through this 5 times and that gets you up to 20 minutes pretty easily. And then you again rest as you need in between if that amount of rest isn't enough time for you. And then the last one is a good way to kind of get outside and get moving as an interval workout. So what you can do is get that interval timer out again, and you're going to set one for 3 minutes and then the second one for 2 minutes. So the 3 minutes, you're going to go out for a run or a jog, whatever pace you can kind of maintain. And then after that 3 minutes is up, then you'll slow down to a 2-minute walk and go back and forth between those 2 intervals for 5 rounds. And that easily gets you up to 25 minutes. And that kind of, that helps create an easy flow of exercise, and it makes it go by really fast. And you can do that as a family as well. So it's kind of a good one for everyone to get out and do as well. So really, overall, even though we have, certain examples here, there's, not really a best exercise for you to do. The best exercise that you can do is one that you'll do consistently, one that's not going to cause you pain, and also one that brings you joy. So you should enjoy doing the exercise. Find something that you'd like to do or that your family likes to do, and that you're going to, say, hey, I get to do this, not that I have to do it. So let us know if you need anything or if you need any help with that.
Hey, thanks, Melanie. That was awesome. So if you guys were listening to this and you're thinking, all right, I know I need to get more active, but you're not quite sure, where to get started, or maybe you've had knee pain or back pain that's been kind of holding you up. This is our field. This is our specialty. Give us a call. We do free consults all the time. Our main goal, we just want to see our community, our state, our country come out of this pandemic healthier and stronger. And like we said earlier, if you're not comfortable coming into the clinic, our clinic is open. We are following all the safety guidelines, but we do have telehealth. And the cool thing about telehealth, you can be anywhere in the state and you get to work with your favorite PTs here at Pain and Movement Solutions. And now your insurance company is likely covering it at 100%. So don't be afraid, send us a message, give us a call. We're here for you. And hopefully everybody can stay well. Let us know if we can help in any way.